Welcome back, ladies and gentlemen. We're going to be talking about the circulatory system. Specifically today we are going to start talking about the heart. Okay, first off, where the heart is located. Unlike what a lot of people think, your heart is not located on the left side of your body. Your heart is actually right in the center of your chest, right behind the sternum. That's why CPR works when you push on the sternum. People somehow think it's on the left, probably because it's a little lopsided to the left, I guess. But it most definitely is not on the left side. And you can tell from the image that it is kind of snuggled between both of your lungs and in front of your windpipe. The line at the bottom where the ribs and things would be ending, right there is the diaphragm that separates it from the rest of the body. Okay, first off, the outside of the heart. Surrounding the heart you have what is called the pericardium. The term is right up here. Okay, and you can see what it is it's a membrane that completely surrounds the heart. Okay, you have these two different layers. I really don't care if you want the names. You don't need to, but primarily remember there are two membrane layers. The harder one is on the outside, the softer one is on the inside, and the big thing to remember is that in between these two layers you have the pericardial fluid. That fluid between the layers kind of makes the pericardium almost like a gel pack or something, that it has this cushion surrounding the heart specifically. That keeps the heart from being damaged as you move around, as it might hit the sternum, hit the esophagus, or not the esophagus, the trachea, the windpipe, and as it moves around it'll give it that protection and a cushion surrounding it. You also can see by the image you have blood vessels coming from the heart that actually feed the heart itself, because the heart being made out of muscle does require blood flow in order to function. So you kind of have a chicken and the egg type scenario. You have to have the blood flowing to the heart so the heart can pump, so the blood can flow. Okay, but that gives you the basic structures on the outside. You can see some of the major blood vessels coming up and over. In this image you can't really see any of them coming down, but they do. This one right here comes down, and this one right here comes over and down and behind, and you'll see that in the next image. Okay, these are the structures of the heart that you really should become familiar with. There are a lot of them, however they follow a specific pattern. Now, first off, the thing that you should notice is that when looking at the heart and identifying the structures, you do it from the heart's perspective, not yours. So the right parts are on your left and the left parts are on your right. This is done as a standard so that if you are in the medical profession and you're talking about the right side of something, you know that it is the organism's or person's right side, not your right side, that is being referred to. Okay, some of the major blood vessels that you'll see Right here you have superior vena cava, which just basically means the cavernous, the large vein above. Superior, remember, means above. Vena is literally Latin for vein. Now when you follow it down, you could also see there is an inferior vena cava. Okay, it's a large vein. It comes from the top and it comes from the bottom of the heart. You also have this major structure, the aorta, which curves up and over the heart and goes down and behind, and it actually keeps going down. It is one of the largest blood vessels in a person. It's about an inch across. In a blue whale, it is big enough for an adult human to crawl through. You also have this blood vessel right here, which is a major one. It splits. You can see one part comes off here, and this goes off the other way. And if you're paying attention, you can tell it is related to pulmonary, in other words, to the lungs. So both of these are going to be related to the lungs, and since there are two lungs, that is why it splits to go into both opposite directions. Okay, right here and right here you have atria. Atrium just means an entrance. The front entrance of a mall or something like that might be considered the atrium of a building. Okay, so think front hall. Okay, those are the atria, plural for atrium. Okay, you can see that there are more pulmonary blood vessels right here attached to them. And you will see that they do not have very thick muscle walls. They're quite thin, actually. Okay, the lower part of the heart are called, each section, there are two. This side is divided from this side right down the middle by what is called a septum. They refer to it as the interventricular septum. It's fine if you just want to call it the septum. This is what is incomplete if they say that someone has a hole in their heart. It just means that two sides are not completely separated yet. Sometimes in either premature children or children that just have difficulty developing, there can be a hole in the heart. The ventricles, you will notice, have much thicker muscle. Okay, if you look at the terms down here on the lower right, you should understand what they mean already. Epicardium, epi, on or over, cardium, heart. This is the outer part of the heart, as you can see. Myocardium. Hopefully you remember that myo means muscle. So the myocardium is the actual muscle of the heart itself. And you, of course, remember it's made out of cardiac muscle. Sorry for the tap. You have the endocardium, which is the inner layer of the heart. Okay, so those should be pretty straightforward. Now inside, in these large blood vessel areas, going from atrium to ventricle, and then also going out into the main blood vessels when it's leaving, you have major valves that are basically just flaps of tissue. You can see this one on your left is called the tricuspid, and the one on your right over here is called the bicuspid or mitral valve. Bi and tri, you know, means 2 and 3. The cusp part means teeth because of the shape of how the valves close. It looks kind of like teeth closing in together. The mitral or bicuspid is just two flaps that close together. The tricuspid actually has three. And you can remember which is which, because if you follow the tricuspid down, you have these ligaments that are attached to the flaps, which are attached to these muscles down here. The tricuspid has three sections of muscle that are pulling on ligaments and the tendons, and you on the bicuspid have only two. Excuse me. Going up into the blood vessels, depending on which one it is, you have the aortic valve, which is going up into this. You can see it kind of tucked in there, and it goes up and over. And you have the pulmonary valve, which is going up to the lungs. These each are what are known as semilunar valves, and you can see that it's because they have these crescent-shaped flaps. And they are strictly controlled by blood flow, not by any type of musculature. Okay, and this is the primary view of the heart that we look at. This is the front. We're not going to worry too much about the back. Most of the structures don't look all that much different from the back anyways. Just so you can see the difference between a drawing of the heart versus an actual heart. Obviously the one on the right is the actual heart. It would normally have a nice red healthy glow, although this one of course is devoid of its blood, so that the color change is there. But you can see the blood vessel structure is just like in the drawing. So, and you can see some of the textures and things of the valves and of the different tendons and things within the heart. Okay. Tomorrow we will talk about blood flow and possibly some other things. So, I will talk to you again tomorrow.